Hi there, and welcome to A&P with Dr. O. In our video here, we are going to take a look at a model that's really going to allow us to focus in on the nephron. We can go ahead and get our bearings first. What we're looking at here is we are looking at a portion of the cortex and the medulla enlarged. That way we can really see the nephron structure a lot better. Again, we know that the outer portion of the kidney is the cortex. Here's our fibrous capsule. And then beneath the cortex, in the middle, we have the medulla, and that's made up of renal pyramids. This would be a portion of one renal pyramid, and we know that it ends in a tip known as the renal papillae. As we're taking a look at nephron structure, we're going to go ahead and we're going to start with this circular structure here, and that is the renal corpuscle. We've got a renal corpuscle here, we have one here, we have another one over here that's a little bit more enlarged that we'll focus on in just a moment. And inside that renal corpuscle is the glomerulus. That's where that ball of capillaries is going to be found. After the renal corpuscle, proximal or closest to the renal corpuscle is going to be the proximal convoluted tubule. PCT is what we use for short. After the proximal convoluted tubule, then we are going to see the nephron loop, which is also called the loop of Henle. We have a nephron loop over here and over here as well. We'll start with our proximal convoluted tubule. We can see a PCT here, we can see one here, we can also see one over here. And what's going to happen is we're going to move from the proximal convoluted tubule, and then we're going to move down. So when we move down, we can see the same thing over here. This is going to be known as the descending limb of the nephron loop. Again, when we move down, this is going to be our descending limb. And our descending limb comes down, and then our nephron loop comes around, and it's going to go up. And then when it travels up, that's going to be the ascending limb. Now, after the ascending limb, then we have a tubule that is further away from the corpuscle. This then is distal. It's going to be the distal convoluted tubule, or DCT for short. We can see the same thing with this nephron. PCT, descending limb, ascending limb, DCT, and then all of these distal convoluted tubules that we can see here, they all are going to drain into the collecting duct, which is eventually going to drain into the papillary duct. Think this is the renal papilla, and then you can associate that with the papillary duct. This is a really great model that also shows the two types of nephrons. We have cortical nephrons and juxtamedullary nephrons. Cortical nephrons are found mainly in the cortex. They have very short nephron loops. We can see this one here, mainly in the cortex, very short nephron loop, versus this one over here, where yes, some of it is in the cortex, but then we have this very long nephron loop that extends down into the medulla. The nephron that is mainly in the cortex with the short loop is going to be a cortical nephron. The nephron with the very long nephron loop that extends into the medulla is going to be the juxtamedullary nephron. We have capillaries associated with our nephrons. We can see them very well in this enlarged nephron over here. So we can see this series of capillaries associated with the nephron. They are known as paratubular capillaries. And then juxtamedullary nephrons also have specialized capillaries known as the vasa recta, which we can see over here in the medulla. And the reason why juxtamedullary nephrons also have this vasa recta is because they are responsible for producing more concentrated urine.